My name is Damon JACOBS. I am a licensed marriage and family therapist, actually licensed both here in California and in New York State. And my interest in PrEP actually goes way, way, way back to working in HIV prevention starting in 1991. So I'm going to fast forward my story a little bit to the year 2010. And by then, I was living in New York City and doing education and outreach for a group called Project Achieve through the New York Blood Center. And it was my job to do education and recruitment for what was called the HVTN 505 trial. This was an HIV vaccine trial. Well, the day before Thanksgiving in 2010, we were all summoned to the office for an emergency meeting. And that was because we had to learn about the results of the PrEP study. Now, I had never heard of PrEP at that time. Why do I have to learn about PrEP? What does this have to do with vaccine trials? Well, it turns out it had a lot to do with vaccine trials, because the results of the PrEP study that were released the day before Thanksgiving, that were about to be published in the New England Journal of Medicine, was this groundbreaking report that a daily medicine called Truvada was able to reduce new HIV infections in research subjects by 44%. Well, as fate would have it, for my job, I was sent to GMHC, Gay Men's Health Crisis, to learn more information about the results of PrEP. Some of the researchers were there to share more about PrEP and answer questions. And what they shared with us was that although 44% was the number that was effective, meaning that averaged in all the participants, the ones who took it 7 days a week and the ones who took it 0 days a week. But when they just looked at the results of the participants who took it 4 or more times a week, there they saw efficacy was 92% or above. And actually, anyone who took it 7 days a week, there was not one participant who became HIV positive when they took it 7 days a week. That, for me, is when a light bulb went on. That, for me, was when it's like, okay, wait a second. Maybe this is right for me. And I took this information to my doctor, and I said to him, look, here's the deal. I'm not using condoms as much as I used to. Now, for me, as a therapist, as an educator, as an activist, that was kind of embarrassing to admit that to my doctor, someone I had rarely had conversations with about sex anyway. But I said to him, look, if I was a woman and I came to you for birth control pills, would you prescribe me birth control pills? And he said, well, sure, of course. I said, well, what if we had a vaccine for HIV? Would you prescribe a vaccine for HIV for me if we had one? And he was like, well, yes, of course. And I said, okay, well, I'm not planning to be a woman anytime soon, and I don't know if we're ever going to have a vaccine. But until then, I believe that Truvada would be the right way and the best way for me to stay HIV negative. And fortunately, I had a doctor who was familiar with PrEP, thought about it, and said, you know what, Damon, you're an adult. And if this is what you think is right, I will support you. He wrote a prescription for Truvada, I got it filled, insurance paid for it, and I started using it July 19th, 2011, and have been using it daily ever since. So it started to dawn on me, and this was really, when people ask about side effects, this was what I call the unintended side effect. I started worrying less. I started sleeping better. I came of age in the 80s when, the idea of having sex meant, you would look like Rock Hudson and you would die. And I had nightmares about that. And I would wake up in the middle of the night with sweats and swollen limbs thinking, this is it, I'm seroconverting. That stopped happening once I started taking Truvada as PrEP. And I started feeling this levity that I had never had before. I had this thought that when Truvada got approved by the FDA, that we would see the same thing. That people would storm the streets, and it was July, so they could have. That people would run to the West Village and embrace and hug and laugh and cry and say, thank God, because we made it through the worst of this. And we're here to see the beginning of the end. And Truvada is going to be such a part of that. That's what I thought was going to happen. But what happened instead? Exactly, nothing. Silence, crickets. The media barely covered this, and it definitely was not getting out there and not getting known into the populations that needed to hear this the most. Well, people did start to learn, but unfortunately that happened as a result of an article that came out 3 days later in the Huffington Post called Truvada Whores. That one of their writers, as a response to what was happening with Truvada and PrEP and the FDA approval, came up with this article that labeled me or anyone who had the nerve to take Truvada for PrEP as a Truvada whore. Unfortunately, that went viral, and that was how a lot of people did hear about PrEP for the very first time. I had been working on education for this vaccine trial for 4 years, and the Data Safety and Monitoring Board looked at the results. They looked at who had been given placebo, they looked at who had been given a vaccine, and they actually saw that this vaccine that we were testing had zero efficacy whatsoever. It had no effect, it had no protection. So they immediately pulled the plug on the study. The funding on my job was immediately pulled, and so I lost my job. You know, he's like, Damon, how you doing? How's it going? How are the vaccine trials? How's everything going for you? And I said to him, well, actually, it's really not going so well. The trials have ended. The vaccine we were working on had no efficacy whatsoever. My job ended, and I'm really disappointed by this. But you know what? At least until we have a vaccine, and at least until we have a cure, we have PrEP. And my friend was like, oh, what's PrEP? So I explained to him what PrEP was. It's this daily medicine that I've now been using for 2 years, and the FDA has approved it, and all insurances are paying for it, and it's this amazing change. And again, it's not the end, but it's a tool that we have now that we never had before. But my friend wasn't excited. He just stood there and looked at me on the street. And he said, why didn't you tell me about this? I tested positive 3 months ago. And I didn't know there was a pill that could prevent HIV. I had never heard you speak about this, or that my insurance would pay for it. And I just stood there, dazed, because he was absolutely right. I hadn't said a word to him. I had not said anything. It wasn't my job. It wasn't my role to do that. And as a result, this person became positive during this time. And that, on top of everything else, really bummed me out and really upset me. And then I got bummed, and then I got angry. Because here we are now, middle of 2013. The FDA had proved this a year ago. I had been using it for 2 years. It was out there. And yet, in New York City, no agencies, no organizations, our own Department of Health refused to give out this information. Nobody would tell men at risk or women at risk that this was a viable tool to prevent HIV. There's not even a place on Facebook where somebody could get this information. And then it was like a light bulb went on. It was like, wait a second, there's nowhere on Facebook that somebody in the world could go to get this information about PrEP. If no one else is gonna do it, I'm gonna do it. Traditionally, when there's been major changes in science, that information has come from the medical community, the media, and what I've seen with PrEP overall is that it's actually been the opposite. It's been educators, it's been activists, it's been consumers who have talked to each other, shared this with each other, gone to their doctors and often educated their doctors about this, especially in areas where there's a lot of doctors who don't know much about PrEP. To this day, the CDC says that 1 in 3 doctors in America don't know about PrEP. And so a lot of the people in my group who are considered to be some of the early adopters of PrEP had to go to their doctor and educate their own doctor about use of PrEP in order to get it. So what came out of CROI last week was the report that although some people on PrEP might have kidney changes while they're using Truvada, that in every instance so far, if someone had kidney changes and they stopped using Truvada, that their kidney functioning went back to normal functioning. So that's good news. It's still a very rare event, but it's good to know that if someone is using Truvada for PrEP and they stop using Truvada for PrEP, that their kidney functioning, if there were any changes, go back to normal afterwards. Again, that was already there. We already had that information, but now we have more empirical data to support that. This is why the CDC recommends that people using PrEP have their kidneys checked at least twice a year, though most providers I know do it 4 times a year. What also came out of CROI last week was what is also considered to be good news about bone density reduction. So there was always this question mark that if somebody uses Truvada for PrEP, would that change their bone density? And in some studies, it had been seen that there were some statistical shifts in bone density reduction over the first 24 weeks. Meaning that for some people using Truvada's PrEP, there was like a 3% reduction in the first 24 weeks. Well, what has been seen and what came out of CROI, again, is that if people stopped using Truvada, that their bone density functioning also went back to a normal level. So this is why, when I talk about PrEP and I teach about PrEP, I say, yes, PrEP stands for pre-exposure prophylaxis, but for those of us using PrEP, it has come to mean something much more. It has come to mean proactive, responsible, empowered pleasure. Proactive, responsible, empowered pleasure. It's proactive because it's something we do every day. I take this pill every day before there's any HIV risk. In case there's HIV risk, I take that control every day. It is responsible because when I take this pill every day, I'm not just deciding that HIV ends with me, I'm also making sure that I don't become positive and accidentally spread it to somebody else without knowing about it. Because when we look at these 50,000 new infections that are currently taking place in the United States, we know, medically speaking, that the people that are most likely to transmit HIV are not the individuals who are HIV positive and undetectable on meds, right? We know with all the science that that chance is nearly zero. So who's transmitting HIV most frequently at this time? Mostly people who don't know. So when I take PrEP every day, I'm making sure that I'm not becoming positive and I'm not accidentally giving it to others. It's empowering because of the reasons that I just read to you, because it's a decision that I make that at least 40,000 of us every day are making to say, I choose to protect myself. My HIV status has always been contingent on somebody else. This is the first time I've had the power to decide that I stay negative every day. What PrEP is doing is allowing people now to have more fulfilling conversations and to feel empowered about the ways they're pursuing pleasure.